How does knowing whether or not people have antibodies in their blood, so evidence that they have previously been infected, how does that change the way we think about a disease?
In the last pandemic we had, which was the swine flu H1N1 pandemic, this was a complete game changer in terms of the epidemiology, the prediction of number of cases that were infected. And we are able to predict that actually there weren't going to be as many deaths as we thought there would be.
So how does the serology test actually work? Because, of course, our blood is full of many, many different kinds of antibodies.
So whereas the PCR test for on nasal mucus depends on whether you've hit the right spot with your swab and whether you've got it to the lab properly, taking a blood sample gives you an absolute estimation of what that person's been exposed to in the past. So it's a much more constant, much more solid measure of viral exposure, and it tells you whether you've been exposed in the past. It's really important information in terms of knowing about the epidemiology.
Peter, if you think maybe you had the virus several months ago, and this is going to be more important as the epidemic goes on, do you think those antibodies would go away, and so there is a sort of window in which you need to have that test?
So the antibody will trend down over time after having reached this plateau at around a month. I would expect the antibody would still be there in sufficient quantity to show up on the test at least a year, possibly much longer after the infections occurred.
If we do manage soon to develop an accurate, sensitive test for the correct coronavirus antibodies, if I then have that test and find I do have the antibodies, that will indicate that I had the virus. Will that also indicate that I am immune?
Yeah, well, I wish we knew. I think from what we know about coronaviruses and immunity to them, I can be pretty confident in saying that if you've got the antibody, you're going to be resistant to infection for at least 3 months. That's the minimum. I mean, it could be that it's going to be a year. That would be quite likely. It could be that because this is a novel coronavirus, which we've never been exposed to before, we're actually going to get much more long-lasting immunity, which could last 5 years or possibly for life. So it could be that we're actually going to develop really good, solid immunity. I think that's the best hope and expectation.